Hello guys, welcome to Dr. Science. So today we are going to talk about prostaglandins and leukotriene synthesis. This is taken from chapter 3 of general pathology textbook. So please read the topic after listening to this. Okay. So let's start. I'll just give a brief explanation of what is going on. So here are your phospholipids. Okay. And in these phospholipids you contain this acid. Okay, can you name the acid which is present in these phospholipids? Yes, it is arachidonic or arachidonic acid. Okay, so this is the phospholipids. So these phospholipids, they contain this acid present in it. This is called as arachidonic acid. So what is this arachidonic acid is made up of? It is a 20 carbons. It means it contains 20 carbons like this. Okay, it is a 20 carbon polyunsaturated fatty acid which is present in phospholipids. Okay, so where does this arachidonic or arachidonic acid comes from? It mainly comes from diet. Okay, or you there is this product called as substrate called as linoleic acid, and this linoleic acid is converted into arachidonic acid, and this arachidonic acid is esterified into the phospholipids. Okay, so we have to separate these phospholipids and this arachidonic acid, right? We want to separate this arachidonic acid or arachidonic acid. So how can we do that? There is this enzyme. Okay, this enzyme will separate the phospholipids and the arachidonic or arachidonic acid. What is this enzyme called? It is called as phospholipase A2. Okay, this enzyme will separate the arachidonic acid. Okay, and this arachidonic acid will eventually go and form, they are prostaglandins, leukotrienes. Not only that, they will also form lipoxins. Okay, so these products which are coming from the arachidonic acid, they are called as eicosanoids. All these leukotrienes, prostaglandin and lipoxins, they are called as eicosanoids. Why they are called as eicosanoids? Because they are 20 carbons. Eicosa means 20 carbons, and they are derived from fatty acids, right? That's why these prostaglandins, leukotrienes and lipoxin are called as eicosanoids. So before going into that, can you name a drug which can inhibit this phospholipase A2? Yeah, inhibiting phospholipase A2 will not only will cause decrease in prostaglandins, decrease in leukotrienes and decrease in lipoxins. Yeah, so what is the drug which will inhibit this phospholipase A2? Those are steroids, right? Steroids are the most potent anti-inflammatory drugs because they will inhibit the entire pathway here. They inhibit the downgoing process of this pathway. Okay, by inhibiting phospholipase A2. So here is a important question and answer. Next we will see how this arachidonic acid will form the prostaglandins. First we will talk about prostaglandins, next we will talk about leukotrienes, and then we will go to lipoxins. So here is the arachidonic acid. So arachidonic acid by the enzyme, it should be broken down, right? So here is also another enzyme. This enzyme is called as cyclooxygenase. Okay, cyclooxygenase will again break this 20 carbon compound into smaller compounds. Okay, so it will cyclooxygenase will break them into prostaglandins. Okay, So we have to talk about the pathways in cyclooxygenase. So suppose this is the arachidonic acid, it has two pathways. If it enters COX1 pathway, which is mediated by cyclooxygenase 1, it will eventually form, yes, thromboxane A2. And if it enters into COX2 pathway, it will eventually from PGI2. PGI2 is also called as, yeah, prostacyclin. So what is the important of this COX1 and COX2 pathway? And there are these drugs which will inhibit. They are called as selective COX1 inhibitors and selective COX2 inhibitors. So what is the importance of this? First we will talk about COX1. So arachidonic acid is converted into thromboxane A2 by the enzyme cyclooxygenase 1. So what are the functions of this cyclooxygenase 1 pathway? So cyclooxygenase 1 pathway, it has mainly inflammatory properties, and not only that, it also has cytoprotective effects and on gastrointestinal tract. So it is protecting the cells present on the gastrointestinal tract. Okay, suppose if we give the COX1 inhibitors, what will happen? It will stop the protection of those cells, and there will be gastric ulceration. So we can say that COX1 inhibitors are contraindicated in patients with gastric ulceration. Okay, you have to be careful with those people who have gastric ulcer in their stomach. Not only that, they maintain this fluid and electrolyte balance in kidneys. Okay, so those were the important things about COX1. So COX1 not only produces thromboxane A2. So what is the function of this thromboxane A2? So thromboxane A2, it causes vasoconstriction. This is very important to know. Not only it causes vasoconstriction, it also causes platelet aggregation. Okay, so suppose this is the vessel. This vessel is dilated, right? So what happens if the COX1 is activated, cyclooxygenase 1 pathway is activated? So what will happen? Thromboxane A2 is produced, and thromboxane A2 causes vasoconstriction. So the blood vessel here is constricted, and not only that, here as you can see, before cyclooxygenase 1 pathway is activated, the blood vessel here is vasodilated, and the platelets are also not activated. Okay, so once the thromboxane A2 here is formed, what happens? The blood vessel is vasoconstricted, and not only that, there is platelet plug formation. So these platelets will go and bind with these blood vessels and occlude the blood vessels. Okay, that is the function of thromboxane A2. So next we will talk about cyclooxygenase 2 pathway. So here is our arachidonic acid, and in the presence of cyclooxygenase 2, it is converted into, yeah, PGI2, which is also called as prostacyclin I2. So what is the function of prostacyclin I2? It is quite opposite from thromboxane A2. Thromboxane A2, what does it do? It causes vasoconstriction and platelet aggregation, right? Whereas prostaglandin I2, it causes vasodilation and inhibits, this is very important, because there are selective COX2 inhibitors such as Cyclooxygenase. Okay, Cyclooxygenase will inhibit this COX2. So what will happen? Prostaglandin I2 is not produced. So what will happen? We will see. So prostaglandin I2 is not produced. So what will happen? The blood vessel undergoes vasoconstriction, right? And there is also platelet plug formation. So this is occluding the blood vessel, right? There is occlusion of blood vessel. So what happens if the blood vessel is occluded? So this is, suppose if the patient is a heart patient who have lot of cholesterol in his blood vessel, there is lot of cholesterol in blood vessel, and upon that you add these platelet plugs. So what will happen? The patient will die, right? So these kind of inhibitors, selective COX2 inhibitors, are contraindicated in patients with heart disease and patients with cerebral ischemia, okay, or anything related with cerebral occlusion. Okay, so that was about prostaglandin I2. Prostaglandin I2, it mainly causes vasodilation and inhibit the platelet aggregation, but we are inhibiting the COX2 pathway. So what will happen? There is vasoconstriction and platelet plug formation, right? Okay, so next we will talk about what are the different types of prostaglandins produced and what is their important functions. So as talked earlier, so arachidonic acid in the presence of cyclooxygenase will produce prostaglandin I2. We talked this one earlier. Next we will talk about thromboxane A2. We also talked about this one earlier. So what is 2 represent here? The 2 is nothing but the double bonds present in it. Okay, uh, so that was about prostaglandins. So what are the other prostaglandins produced here? Prostaglandin D2. What does D stands here? It causes dilation. Not only that, it causes disturbance of neutrophils. It means prostaglandin D2 causes vasodilation and it is a chemotactic factor for neutrophils. It means it attracts more neutrophils to the site of inflammation. Okay, next we will talk about prostaglandin E2. Prostaglandin E2 is a hyperalgesic. What is meant by that? It induces pain. How to remember this? E for elephant, right? Elephant causes pain. So prostaglandin E2 causes elephant pain. Okay, not only that, it also causes fever. So that was about prostaglandin E2. So next we will talk about prostaglandin F2. So prostaglandin F2, it constricts, it causes contraction of the uterus, and not only that, it causes contraction of the bronchial smooth muscles. Okay, so that was about prostaglandins. And where can you find these prostaglandins? That is very important. Prostaglandins are mainly found in the mast cells, macrophages, and endothelial cells. Okay, so next we will talk about leukotrienes. So as talked earlier, arachidonic acid, okay, in the presence of 5-lipoxygenase. Okay, the enzyme here is 5-lipoxygenase, which will convert the arachidonic acid into 5-hydroperoxy icosa tetraenoic acid. Okay, 5-HPET. Okay, so this 5-HPET, either it can form 5-HETE, which is called as 5-hydroxy ecosa tetraenoic acid, which will attract neutrophils, or it can enter into another pathway, which is the 12-lipoxygenase pathway. It means the enzyme working here is the 12-lipoxygenase, and it will produce substances such as lipoxin A4 and lipoxins B4. So what is the importance of this? They have anti-inflammatory effects. Okay, so this 5-lipoxygenase is mostly present in neutrophils. And okay, so once this 5-HPET is activated, it is converted into leukotriene B4, leukotriene C4, leukotriene E4, and leukotriene D4. Okay, or we can wait a second. Leukotriene D4 and leukotriene D4 and leukotriene E4. Okay, so what is the function of leukotriene B4? It is also a chemotactic factor for neutrophils, whereas leukotriene C4, D4 and E4, they have all these common functions, which is they will increase the vascular permeability. Okay, and not only that, they will cause bronchospasms. Okay, so this was about the leukotriene and prostaglandin synthesis. Now we will take a look at the diagrams. Here are the phospholipids. In the presence of phospholipases, they are converted into arachidonic acid. So if the pathway is activated by cyclooxygenase, I already told you the cyclooxygenase 1 and cyclooxygenase 2 pathway. Here it is not mentioned. So select here we can inhibit this cyclooxygenase by aspirin, indomethacin. Okay, so here are the function of prostaglandin I2. It causes prostaglandin I2 is called as prostacyclin, and it causes vasodilation and inhibits platelet aggregation, whereas thromboxane A2, it causes vasoconstriction and promotes platelet aggregation. Prostaglandin D2 and E2, they causes vasodilation and increased vascular permeability. Not only that, prostaglandin D2 it disturbs the neutrophils. It means it is a chemotactic factor for neutrophils, and prostaglandin E2, it is a hyperalgesic. So here is the enzyme 5-lipoxygenase. If 5-lipoxygenase pathway is activated, it is converted into 5-HPET. Okay, and 5-HPET is converted into 5-HETE, which will attract the neutrophils. Okay, and leukotriene A4, leukotriene C4, D4, E4 are formed. Leukotriene C4, D4 and E4, they causes bronchospasm and increased vascular permeability. Whereas the 12-lipoxygenase enzyme is activated, it forms lipoxin A4 and B4, which will inhibit the inflammation. So before ending the topic, I would like to describe the drugs which will inhibit these synthesis pathways, and it is very important to know these drugs. So let's start with steroids. Okay, so steroids, as you can see, they will inhibit the phospholipase A2. Phospholipase A2, if phospholipase A2 is inhibited, there is no retraction or collection of this arachidonic acid. Okay, so if arachidonic acid is not formed, there is no formation of prostaglandins, there is no formation of leukotrienes, and there is no formation of lipoxins. So entire all these three pathways are inhibited. So steroids are considered as the most potent anti-inflammatory drugs, right? And next we will talk about COX-1, COX-2, aspirin and indomethacin. All these will inhibit the synthesis of prostaglandins. Okay, so I already talked about COX-1 and COX-2 pathways, right? So next we will talk about the 5-lipoxygenase inhibitor. Can you name it? Yeah, it is called as xylitol. Xylitol will inhibit the 5-lipoxygenase enzyme, and there will be no production of leukotrienes like leukotriene C4, B4, D4 and E4. Okay, so this can be used in asthma, right? Because in asthma there is leukotriene production, and leukotriene causes this bronchospasm, right? So next we will talk about leukotriene receptor antagonists. So these are the endothelial cells, and endothelial cells have this receptor. Okay, this to this receptor, so this is the leukotriene. So this leukotriene B4 or C4 or D4 will come and bind to this leukotrienes receptor, right? So there is a drug which will inhibit this leukotriene receptor, or we can say this is a not an inhibitor, it is an antagonist. Okay, such an drug is called as montelukast. Okay, so here is our montelukast, which will inhibit the leukotriene receptor antagonist. So that was about the drugs I wanted to talk about. Thank you.